The 7 causes of high ferritin and how to fix it. That's what you're going to learn today as I talk about a patient who lowered her ferritin over 1,000 points to normal in 4 weeks and at the same time resolved her high triglycerides, uric acid, and CRP marker for inflammation. My name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and author of The Free Diet. And I've been blessed to have seen over 100,000 patient visits over the last 38 years, many of whom have gut and thyroid issues. And this patient was one of them. 64-year-old woman who was complaining of nausea, bloating, abdominal pain, diarrhea, constipation, fatigue, brain fog, heart palpitations, itchy skin, hives, tinnitus, vertigo, depression, anxiety, and many other symptoms. She's had these for years and had been to numerous doctors with no progress. I ran initial lab testing and it showed that she had high ferritin of 1,094. Normal ferritin levels are for women 15 to 150. Optimal is 50 to 80, depending on other factors. She also had high liver enzymes, high iron and saturation, high C-reactive protein, marker for inflammation, high triglycerides and uric acid, and low DHEA and adrenal hormone and vitamin D and B12. And functional tests revealed she also had celiac genetics with gluten sensitivity, candida yeast overgrowth, and high gut inflammation markers. So the first step when someone has high ferritin levels is figuring out what is causing it. And there are 7 main causes. I came up with the acronym LA5Is, LA5Is. So you have liver disease, alcohol use, insulin resistance, inflammation, infection, illness, and iron overload. And how do you determine which of these 7 it is? I'll go over a comprehensive health panel, which is a blood test that measures CBC, comprehensive metabolic panel, lipids, TSH. These 4 are what your doctor orders, and that's it. This patient for years had been getting this test and couldn't find anything wrong with her. You want to also get ferritin, serum iron, saturation, and TIBC, CRP, which is C-reactive protein for inflammation, LDH, GGT, insulin, A1C, uric acid, free T4, and free T3. That is the minimum to assess high ferritin. I like to check other markers as well: ANA, thyroid antibodies, reverse T3, DHEA, cortisol, testosterone, estrogen, B12, folate, vitamin D, urinalysis. And for high iron saturation, over 45% like hers was, hemochromatosis, DNA. And out of those 7 possible causes of high ferritin, these results indicated she had liver dysfunction, alcohol use, greater than 2 drinks a day. She was drinking 3 per day or over 21 drinks per week. And she was only 5 feet tall. So that's a lot. That can raise ferritin. Insulin resistance. She had high blood pressure, high triglycerides, low HDL, high uric acid, excess belly fat, inflammation. Her markers were high, and iron overload. And she did have positive hemochromatosis DNA. Hemochromatosis is a genetic disorder that causes one to accumulate iron. Her genetic marker, only 2% of the people with this develop iron overload. So why was she in that 2%? Well, when you add these other issues, the liver dysfunction, alcohol overuse, insulin resistance, and inflammation, you can see where that, along with the genetic predisposition for iron overload, could take effect. So the traditional treatment is therapeutic phlebotomy or blood donation. She was able to do that 3 times in that first month before she became severely anemic, so she had to take a break from that. And each phlebotomy typically will lower ferritin about 30 points. So for her, that would have only gotten her to about 1,000. And we wanted to get her to below 100. Step 1 was proper testing. Step 2 is an anti-inflammatory diet. Step 3 are the proper supplements. I'll go over that with you shortly. And the end result was, after 4 weeks, we retested and her ferritin went down over 1,000 points to 92. Her iron and iron saturation dropped to normal. Her liver enzymes, C-reactive protein, triglycerides, uric acid all dropped in that 50 to 60% range to normal levels. Her DHEA, vitamin D, and B12 increased to normal levels. And she was feeling so much better. Her gut symptoms, fatigue, brain fog, tinnitus, anxiety, depression, vertigo, heart palpitations, all were better. And she dropped 8 pounds. And during that first month, her blood pressure reduced over 20 points to normal. So she was feeling like a new person. And the anti-inflammatory diet I put her on, I call the free diet. It's a diet I came up with years ago when I was discovering how to heal my own Hashimoto's autoimmune thyroid condition, rheumatoid arthritis, IBS, fatigue, skin, and other health issues. So with that, I was able to get better. And I call it the free diet because it's free of not only gluten, but gluten grains, sugar, yeast, dairy, eggs, soy legumes, nightshades, processed foods, all those foods most commonly responsible for inflammation, gut, thyroid, and other chronic health issues. I'll put a video at the end of this one that goes into that in more detail, as well as a link to the free diet phase 1 food chart that we can send you along with other resources. And step 3 of the proper supplements, I gave her the functional 5, which is multi-fish oil, vitamin D with K, magnesium, probiotic, digestive support nutrients, including gastric zyme and yeast to feed, liver support, sublingual B12, DHEA, and cortisol quencher for adrenal support, and then a quercetin supplement and metal cleanse. She also did the infrared sauna 2 to 3 times per week, because that can help excrete heavy metals, including excess iron. So with that, number 1, getting the proper testing. Number 2, the free diet. 3, the proper supplements. She was able to drop her ferritin by over 1,000 points in 4 weeks, improve her other lab markers, clear up her chronic gut and other health issues, and feel like a new person. So if you get the proper testing to determine your root causes and are provided the right solutions, I believe almost anyone can get better. Thanks for joining me today. I will put a video that goes into the free diet in more detail here, the free diet phase 1 food chart below. Feel free to like and subscribe so more people can see this video. And I look forward to seeing you next time.